This is a large collaborative study between the Dana-Farber Cancer Institute and the Mount Sinai Hospital in New York. And it involves a 2,500 patient cohort, which we've been following since the onset of the pandemic in New England and New York, which was in March of this year. And what we did is we prospectively followed these patients, and what we reported on here was at 3 months into the pandemic, what we'd seen in terms of multidisciplinary cancer care disruption. So we were looking at how patients' interaction with the healthcare interface had changed. And what we found was that not surprisingly, patients were utilising more telehealth, and this was well documented now during the early part of the pandemic. We found that, interestingly, there seemed to be a difference in the racial groups that were utilising telehealth more. And what we found was that patients from minorities were less likely to have an uptake in telehealth use. We're unable to comment on what the reasons behind this might be, but it was certainly an interesting finding. And it's been documented before that perhaps people from minority groups, for a variety of reasons, perhaps less access to either technology or less familiarity with it, have been less likely to use measures which might be able to mitigate the risk of COVID-19, because, of course, having a telehealth conversation reduces the physical contact with the healthcare interface. And so what we're doing now is we're continuing to follow that cohort and trying to identify what the risk factors might be for patients developing COVID-19 over time, and to see whether the disruption in how patients are utilising care, for instance, telehealth, has changed during the pandemic.